So I will let you do your intro. Tell me your role, your title, just so I make sure we get it right today.
The who's who.
Yeah, the who's who.
Okay, so I'm Jennifer Esposito. I'm the general manager of the Health and Life Sciences team at Intel, and we're a technology company, but we're not really producing products for the healthcare industry. We're really working with the ecosystem to make sure that the latest and greatest technology ingredients get applied, and that we understand the new use cases and the new workloads that are emerging so that we're ready for the future.
Are you wearing a wearable device
I am
today?
not, actually. I use my phone.
Oh, you just use the phone?
Yeah.
Have you tried any of them?
I have tried the Fitbits and a few different things. Yeah, I love the phone because it's always on me all the time and use it for many other things. So,
yeah, so I'm super curious for your perspective on that because I am also I don't have a wearable on me right now. And the problem is that you leave it at home sometimes. Right. But with the phone, I mean, if I left my phone at home, I would feel like super weird and have to run home.
Absolutely.
So how do you get wearables to that point where we get as agitated about leaving them behind as we would our smartphones?
Well, I think part of it is about, wearables are going to continue to evolve such that they're not something that you have to remember or forget. They're just always there and they're always on you. And so I think, technology is going to help with that from the perspective of that evolution of the form factors getting smaller and the ability to sort of have really low power devices that don't require, for example, being charged up all the time and things like that.
And that's where you guys come in because, you're doing the chips and battery life. Like I keep hearing at this conference that one of the barriers to getting adoption of these new technologies is just that you have to charge them every day. And for a lot of populations, including, say, seniors, this can be something that you forget to do, and hence they end up in the drawer. So when do you think we're going to get to the point where we can have these wearables working so that we only need to, say, charge them once every week or two?
Well, I think we're looking at 2 to 5 years for a really good complement of different wearables. I think ultimately, though, you're going to also sort of see this morphing of the biological with the physical world, right? And you're actually going to have embedded sensors so that you really don't have to think about it. And that's going to, again, require very low power, very small form factor to do.
Wait, so do you mean like I swallow a sensor?
Something, swallow it, embedded, whatever. I think there's lots of interesting opportunities to make it easier. And I think we're getting there with sort of this convergence of the evolution of the sensors, the ability to do more of the, the analytics or the AI at the edge wherever patients are at, and things like 5G and the network allowing you to pull all that together in really meaningful ways, real time, 24/7, so you can react to it.
So could you talk me through like the vision of how this all looks in, say, a decade from now? Like, is this going to be like a Black Mirror type thing where we all
I hope not.
Like wake up in the morning and like put on our wearable patch and it's recording our conversations and I don't know, tell me, like, what do you...
Well, I always wonder when I start to say this, it sounds very Black Mirror-ish or whatever it is, right? But I do think that, whether it's ingestible or embedded or on your body in such an easy way, whether it's closed, I think, first thing I want to say, too, is it's not just the data that's coming off of the patient. That's really important, right? We've got that sense from fitness wearables. But, the other thing that I find really interesting and important is the things that are around the patient, the contextual data in their environment, whether it's in their home or in their city. So I'm actually really excited about a picture that sort of isn't just about that data from the patient. It's sort of this world view of everything that's going on that we all know impacts health. When I was in grad school, I was working on epidemiologic studies of cancer, and we were manually collecting all sorts of environmental data, and we were doing it once a month. Now you can kind of collect that kind of data 24/7 and really understand how it impacts individuals, but also populations.
Oh, so do you mean things like what levels of toxins are in your
pollution,
home? Or,
water quality.
Or if you have asthma, like when's the right time to leave the house?
Right, exactly. And so I think that really, we know those things inform health. And so I think to really not have that piece of the puzzle at this point is sort of a little bit of a gap in the knowledge that we need.
So what do you do every day at Intel? Like, what are you passionate about? And what is the scope of things that you're looking into and maybe avoiding because it just doesn't fit into the core competency?
Well, we do a lot of work with both, other companies in the ecosystem that are building products to understand what some of their challenges are to help them, for example, optimize maybe their architecture or the technology ingredients that they're using, and so that they can bring it to market at a cheaper price point or make it work faster, better. We work really closely with end users, whether it's hospital systems or pharma companies, to really understand some of those extreme use cases that are really challenging them to really deal with problems. And then we come back and think about maybe some of the partners that we've been collaborating with or some of the technology that we've been working on, and think about how you can potentially stitch some of that together. So sometimes the output of that is working directly with a company to sort of help them bring something to market. In other cases, what we try to do are build things like reference designs or reference architectures, which sort of builds a framework that other people can build on and is relatively open. I mean, one of the things that we feel strongly about is making that kind of knowledge broadly available. It's not about exclusively working with one company versus another. It's really about bringing that out into the ecosystem so that everybody can take care of the technology.
So at conferences like these, people will often ask me about the sort of tech entrants and what their strategy is, because it's something I focus a lot on in my reporting. And very often you sense this undertone of deep skepticism. Like, how can these tech folk know anything about healthcare? And I think that there are some reasons why that might be fair and also not fair. I'm curious whether you've come across that, and what is your response to it?
Well, I do think, when you sort of have a very technology-only focused view of it, you sometimes do have a gap. I think one of the things that I see a lot is examples of solutions or technologies that don't really account for the workflow in the health system or the workflow that a physician or a nurse is facing. And so I think that's one of the points at which you start to hear sort of that skepticism, because you're trying to bolt on maybe a solution that worked in another industry and try to assume that it's going to work just fine in healthcare. And so for me, I think it's very important to understand workflows. We've done in the past a lot of work around ethnographic analysis of how people are using their technology, how does it feel, and iterating from that. And I think those are really important points to bridge that gap and sort of dispel some of that skepticism.
Do you see any ego on the part of technology companies that, we can do this better than you can because we have this disruptive mindset, you don't?
Well, I'm not sure if it's ego. I do think that depending on which technology company you're talking about, some of them have really great expertise in specific areas that would be really important to leverage in healthcare where there are gaps, whether it's logistics or artificial intelligence, right? And so I think it's the balance of sort of mixing and matching the right skills, and if you're really good at certain tasks, bringing that into the mix. Because I don't think healthcare alone can sort of solve all of these challenges, and it doesn't make sense either to reinvent the wheel.
So you mentioned artificial intelligence, which was probably the biggest, most important theme 3 years ago at JP Morgan. But I haven't heard that many people talking about it this year. And it could just be that these trends kind of come and go, and now we've moved on to other things. So what is realistic, or where are you seeing AI actually do something in healthcare as opposed to just being like a splashy headline or white paper? Like, where is it actually impacting and doing things that are having a positive, or making it easier to be a physician these days, or doing anything real?
Well, for us, last year, 2018, was sort of the year of AI, where we done a ton of work to show some of the use cases. And I think we were trying to say AI is real, it's happening now, it's possible, and also it's possible to use your existing technology infrastructure to do some of that. So we've done a lot of work, for example, with Montefiore Medical Center in New York. They're working on pulling together all of their data such that they can start to make predictions in the wards, and using that data to inform whether or not people have actually looked at it, figuring out how it fits in the workflow. So I think that's an example of sort of clinical hospital operations where you can impact patient care, but you also can think about some of the resourcing that you have. I think some of the other use cases that people can work on right now are the ones that are a little less sexy, the financial and the administrative and the operational ones, which I think give health systems an opportunity to sort of get an entry into artificial intelligence, get their system set up, get some expertise set up, and then really use that as a way to show the value, because there's a lot of opportunity in those sorts of use cases to pull value out and have some really impressive wins in the short term that will allow you to expand to some of the other use cases that are more clinical. And then the other one, I think we've done a lot of work this past year in radiology. I mean, it's a really ripe opportunity.
Everybody wants to get up the radiology specialty. I wonder how radiologists are feeling right now.
Well, I think this is interesting. I mean, my perspective is this is about augmentation of the work of physicians, helping them, sort of triage those standard cases, focus on the most complex ones. So I think we're moving to a point. It's not going to. My feeling is it's not about replacement. This is about augmenting and assisting physicians and other clinical workers to operate, at the top of their licensure, the top of their expertise, and really save some of the more mundane tasks for AI.
By the way, I talked to someone last week who had trained pigeons to spot cancer imaging.
Interesting.
So I think we should also be asking whether AI will replace pigeons.
I don't think anybody wants a pigeon in the hospital, right?
So I do want to ask you, how do you know that it is AI? Because very often people say to me, this is AI, we've got AI, and I'm like, are you sure it's not a spreadsheet? Or like some kind of decision tree? And why can't we just say we have a spreadsheet? Would it be so wrong to just be honest about, what technology we are using? Because sometimes that makes the most sense.
Yeah. Well, I think it is funny because I think, some people have very strict definitions of what is AI and what isn't. I do like people to think about the fact that, think about analytics in general and leveraging advanced analytics and then sort of moving up the curve, right, to sort of that full-blown AI that people are talking about. Because I think people have to think about that as sort of the progression. It's not necessarily that this is AI or it's not. If you are using a spreadsheet, that's actually way better than using paper, right? So you're moving in the right direction.
So it's not paper.
Not paper, anything that's sort of, again, it's about assistance and taking away some of that sort of burden that, doesn't allow things to become real time and to sort of flow into what people are doing on a day-to-day basis.
So in my own conversations with folks that are doing some form of data gathering in healthcare, they'll tell me about some device or whatever, app that collects all this data. And then my next question is so what? Why? Who is going to benefit from this? And very often you see people only think about the sort of data gathering piece, and then it ends. There's an assumption that will just do something great. Do you see that as well? And is it a particular problem within the healthcare space?
No, I think it's everywhere. But I think, just like you said, it's not just about the collection. I'm excited about what happens after you collect the data. As you build predictive models or alerts or capabilities, for example, to use digital therapeutics to deliver care for patients in their home. And that digital therapeutic is adaptive to the real-time data that you're collecting about them. And so that, you really are starting to shift that balance of care outside the hospital into an environment where patients are more comfortable.
Can you think of any examples where it's actually a bad thing to be collecting data about our health?
Oh, well, I think that's interesting. I think, I don't necessarily think so. I mean, I do think it really depends on how you're securing the data and keeping track of it. But I do think that we don't necessarily know what we don't know at this point. And kind of back to my earlier points, there are all of these other factors around patients that are contributing and that will help inform sort of a new world of care delivery and research.
So you guys have this technology that kind of analyzes a lot of some of the wearables that we've talked about. So are you thinking about how these devices are going to get into the hands of people who are not in the camp of what many in this room would call the worried well? The people that can afford these devices are already fairly healthy, and we don't really need to be focusing on them quite so much. How do we get them into the hands of people who are sick, who are aging, who may benefit more than the sort of healthier counterparts, the millennials?
Well, I mean, first thing I want to say is I actually think that sort of because people are carrying phones and all of these other devices, the shift away from just being about healthcare and reactive care really is going to start to transition into something around continuous health and wellness. And so I am actually really concerned still about the worried well or whatever we want to call them, because I do think that that's sort of a game changer or a shift overall that we're going to start to see over the next 5 to 10 years. But I also think to the current populations of the elderly or the poor, we know the cost of some of these technologies are going down steadily, and so it's going to make it much easier to do that. But at the same time, I also think that you come back to making it easy for them and making it sort of non-disruptive to daily lives, and utilizing things that are already around them to capture that data.
So from a sensor perspective, right now we've managed to crack this electrocardiogram ECG thing, which folks have been working on for a long time,
Mm-hmm.
and we obviously have heart rate and steps. What's the next thing?
The next thing to collect? Well,
or the next vital sign.
Well, I think some of it's just activity and what people are doing, and being able to use motion and understanding people's motion and fitness is really important to the overall picture of health. We know that contributes a lot to people's success or none with chronic disease management and things like that. I think understanding what people are eating is another really interesting one to think about.
How do we do that?
I don't know yet. Don't know the answer to that one, but I do think that's really important. So, again, back to my earlier conversation around shifting to health and wellness versus care. I think some of this the capabilities will allow us to really, because there's more pervasiveness in the capture of data, you also can sort of extend education about what people are doing and how it impacts their overall health and well-being.
Have you looked at areas like non-invasive, continuous blood pressure, blood glucose, things that people often call the holy grail in the biomedical world?
I haven't done a ton of work in that area.
Well, if you find out anything more about it, those are areas I'm certainly interested in. Cool. So I asked the same question of our last panelist, but I keep droning in on this or honing in this issue of just getting more diversity into JP Morgan and some of these other conferences. What do you have? Do you have any personal goals or company goals around just bringing more women into the fold for 2019?
Yeah, I think it's definitely been a priority at our company, and I think as someone who's relatively visible in this particular industry, I have really enjoyed bringing people on as interns to our team. They've done some really great work with us, and it's a way to get people exposed to. For example, people that are working in health research or health policy, coming into a technology company and thinking about how that applies. We had a great PhD intern with us for a couple of years, and she was a health policy PhD candidate. But, so it was sort of a non-traditional entry into technology, but I think building more of those opportunities and experiences for women that are studying in this field, but not necessarily in technology, is a great way to expand this.
So you guys are hoping that, within sort of this remit of health policy and some of these other areas that folks there aren't intimidated by, opportunities in the technology field?
Well, even me, I didn't come from a technology background. I have a master's degree in epidemiology, but I always loved technology, and so you sort of just immersing yourself. Found a way, right? And it didn't necessarily click immediately, but I do think you have to open up, it's sort of diversity of experiences is part of the story here, and getting more people exposure to these
win-win.
things. Win-win, absolutely.
Wonderful. So we're out of time. Thank you so much.
Great chatting with you
today. Great chat with you too.